Hi everyone, welcome to Wednesday Treatments with Dr. Ankita. Today we are going to talk about what is an IVF cycle. Whenever you are talking about a test tube baby or an in vitro fertilization cycle, what is it exactly? Many of them are working couples and they are worried that how are they going to apply for leaves, how much time is it going to take out of their entire month, or how should they schedule their work around their IVF cycle. So let's understand today how that happens. An IVF cycle is, there are two parts in an IVF cycle. One part is where we stimulate the ovaries of the wife and we retrieve the eggs and we form the embryos. The second part is where we implant those embryos back into the uterus of the wife. Now, an entire IVF cycle could be the whole process in one single month where we are stimulating the wife, making the eggs, taking them out, forming embryos, and in the same menstrual cycle putting them back into the uterus. Another way of doing it is stimulating the wife, taking out the eggs, making the embryos, taking a break, freezing the embryos, and in the next menstrual cycle or whenever the couple wants to schedule, we schedule the frozen embryo transfer. Let's talk about the first part of the IVF cycle. What happens in the first part is the ovarian stimulation, retrieval of eggs, formation of embryos. Ovarian stimulation is a process where starting from day 2 or day 3 of your periods, your fertility specialist would advise you to take certain injections. In technical terms, we call these injections as gonadotropins. Now, these injections could be taken on the tummy under the skin or they can also be taken on the buttocks. These injections are going to help your ovaries to make more number of follicles. There are around 11 days of these injections. Somewhere around the 7th day of your injections or when the follicle size reaches a 14 mm, a new injection will be added to this protocol known as antagonist, which is going to prevent the rupture of these forming follicles inside your body. After 11 to 12 days of injections, when a good number of follicles reach a size of 18 to 19 mm, the final and the trigger injection is given. It is important that you take these injections in a common time frame. If you're taking them in the morning hours, you continue taking them in the morning hours. If in the evening, then in the evening. Your doctor might also prescribe some hours of gap between the antagonist and the actual gonadotropin, or your doctor might just advise to take them all together. It depends from expertise to expertise, person to person. The trigger injection is one of the most important injections of your entire cycle. You will be given a specific time at which you have to take your injection. Accordingly, your egg retrieval procedure will be posted. These injections, if the clinic is nearby, you can go to the clinic and get your shots at the clinic. If your clinic is far away, you can pack these in an ice pack and take them home. After your trigger injection, within 34 to 36 hours, the egg retrieval procedure is planned. You are given complete anesthesia for the egg retrieval procedure. There is no cut, there is no stitch. With the help of a long needle, all the follicles are punctured and all the follicular fluid inside the follicle is drained out, which also contains the oocytes, the egg. In the laboratory, around the same day of the egg retrieval, your husband will be asked to give a semen sample. Some labs also keep a prior frozen semen sample for backup for emergency situations. If there is a male factor involved where there are procedures like TISA or PISA posted, then they will take place on the same day as your egg retrieval. On the day of the egg retrieval is the same day where the eggs and the sperms are mixed to create embryos. In an IVF, in vitro fertilization, the eggs and the sperms are left together in the dish and the sperms themselves go and fertilize the egg. We call this the natural selection. In ICSI, intracytoplasmic sperm injection, inside the lab, each egg is held by a pipette, and with the help of a syringe, a selected single sperm is introduced inside the egg and they are kept in a dish to form embryos. In IVF, the egg naturally chooses the sperm. In ICSI, your embryologist chooses the sperm that is going to fertilize the egg. After 48 hours, we look for development of embryos. If in this very cycle, around day 3 of development of the embryos are transferred back into the uterus, it is an autologous transfer or a fresh transfer. Your doctor might freeze all the formed embryos on day 3 or on day 5 depending on the protocol of the clinic, and they might ask you to wait for your periods. Once you get your periods, then your uterus is prepared for embryo transfer and the frozen embryos are transferred next month or months later according to your scheduling. That is frozen embryo transfer. In general, if you are doing a fresh transfer, you need to have at least 20 days of leaves in your hand. First 12 to 13 days are going to go in stimulating your ovaries and forming embryos. After that, 3 days, the embryo transfer is going to be done. If it is only stimulation, egg retrieval and forming embryos and a frozen embryo transfer has already been decided upon, you need first half of your cycle, 14 days of your menstrual cycle, to be free of any commitments that might require you to leave the current locality and go outstation, to occupy most of your time. You have to prioritize the treatment. There are few very important details of the treatment that those 14 days your life actually circulates around it. Like I've already mentioned before, when you take the injections, taking them during a particular time frame is helpful. If your doctor has prescribed a particular gap between the antagonist and the gonadotropin, following that might help you. You might be put on various supplements. If you have low ovarian reserve, you might be on supplements for that. If there is something else, you might be on supplements for that. It is very important for you to maintain a timely chart of what medication to take when. So that's all about in vitro fertilization or test tube baby cycles. If you have any question, please comment, write them in the comment section below. Like, subscribe and share. Thank you so much.